Hello everyone. Today we will move on to the next question of dissection of anatomy. The next topic is ribs and sternum. Actually, I've made a complete video of thorax of ribs, sternum in detail. So in this video, I would give just a outlook of it. If you want a detailed one, please go and watch those videos. But in this video, I would tell the important things which you need to tell in the viva questions, because in viva they won't listen in detail. We should tell only the point to point information which they need. Okay, so in this topic, we would see the ribs and sternum, their development, structure, variants, and anomalies, joints of ribs with the vertebrae and sternum, chest as a whole, its movement, its blood supply, and innervation. Now we would see the development. Mesenchymal, now development of ribs. Okay, how does the ribs develop? See, first, it takes the origin from the vertebral column. Okay, the mesenchymal costal process, its origin site of union of costal process with the vertebrae. Now, rib has a costal process and its origin site with the vertebrae. Then later it is replaced by the costovertebral synovial joint. Now, to study this in detail, you need to go through the embryology and development. Then only you would get what is the meaning of this. But in short, in viva, you need to say this, that is, it's a mesenchymal origin. Then it has a union with the vertebrae costa through the costa process, and then it forms later, it replaces by costovertebral synovial joint. Okay. Now next is the sternum. See, how does the sternum develops? A pair of vertical mesenchymal bands. This is also a mesenchymal band. Okay, this is also called as sternal bars, which develops ventrolaterally and moves medially. Okay, it develops ventrolaterally and moves medially. Okay, and then quantification happens, and then fuse it craniocaudally. See, this is the cranium, this is caudal part. Then it fuses craniocaudally, all the bands. Okay, and forms a manubrium, sternal bar, and xiphoid process. And this ossification happens in the childhood. Okay, this is the short information about the development of the sternum. See, now next, thorax. These are the markings of the ribs and sternum. They would ask you that what is this process called, what is this structure called as. But this is very basic thing. Still, this is the body of the sternum. Okay, second is the manubrium. This is the manubrium of the sternum. This is the superior thoracic aperture. You cannot see from here, but see, I will tell you, this is the rib body. Okay, here is the costal process. It's coming like this up in front from the behind, and here is the manubrium notch. Okay, wait a minute. See, now this whole thing is called as superior thoracic aperture. I have told everything in detail, like which things pass out from this superior thoracic aperture, like veins, arteries, which are the important things. Everything I have completed in detail. So please go and watch that video so you would get a complete clearance about it. I would put those links in below the description in this video. Now next is the fourth one, is this clavicle. Okay, this is the clavicle. This is scapula from behind. This is sixth rib, and seventh is the xiphoid process. These were just the outlines of the thorax. Now next topic, like while telling in the viva, you should use the Latin terms. It's mandatory sometimes, but some teachers would understand that in English terms also. But if you use the Latin terms, it would be most effective. They would understand that yes, you have studied. So see this part, like costa vera, costa spurae, and costa fluctantis. Now this costa vera is called as true ribs. Okay, true ribs. This is costa spurae. Okay, this is called as false ribs. False ribs. And this is called as floating ribs. Now, which are the true ribs? Now, which are the true ribs? The first seven ribs are true ribs. Okay. The next three ribs, 8, 9 and 10 are the false ribs. And the next floating ribs are 11th and 12th. This just I'm telling the basic things. It's a very basic thing, but even if you tell this confidently with the Latin terms, it's a kind of a bonus point for you. But if they would ask the deep questions, then you need to watch those videos which I have already posted. Now, see, okay, this detailed structure is okay, but what are the variants and anomalies in this ribs? Like most frequently in ribs, the presence of accessory cervical rib or the absence of the rib 12th on one or the both side, and the presence of the 13th pair of rib correlates with an increase in the number of thoracic vertebrae. The anterior end of the ribs are sometimes fused or bifurcated. Now, these 3-4 points are the variants and anomalies of the ribs. Now the next part is the muscles and joints. Okay, muscles which helps in the movement of the ribs and complete thorax. Now see this there are superficial and deep muscles. We would start from the superficial muscles. First is the pectoralis major muscle. Its origin is medial half of the clavicle, manubrium and body of the sternum, and cartilage of the 2 to 7 ribs and sheath of the rectus abdominis muscle. And its insertion is crest of the greater tubercle. Now, what is the action of this muscle? It helps in the adduction of the humerus and raising the ribs and participates in the inspiration. Now, its innervation is medial and lateral pectoral nerves. Next is the pectoralis minor. Now, its origin is ribs 3 and 4 and insertion is coracoid process of the scapula. And action is brings the scapula forward and downward. When the pelvic girdle is fixed, it raises the ribs. Its innervation is anterior branch of the pectoral nerve. Now, like if you want to understand the muscles also, I've just posted a very short each muscle separately. So if you want to understand detailedly, just watch those videos, then you would get the position of the muscle also. Subclavius muscle, its origin is cartilage of the rib 1 and insertion is acromial end of the clavicle, and action is pulls the clavicle medially and downwards. Its innervation is the subclavian nerve. Now next and the last muscle of the superficial thorax, muscles of thorax is serratus anterior. Its origin is rib 1 to 9 and insertion is medial margin and inferior angle of the scapula. Action is pulls the scapula laterally and downward, and its innervation is long thoracic nerve. Now next are the deep muscles. Now deep muscles, there are external intercostal muscles, internal intercostal muscles, subcostal muscles, transversus thoracic and levator costorium. Now from this terms like external, internal, intercostal, subcostal, transversus thoracic, you would get easily that where is the position of this muscle. See, its origin is inferior edge of the rib and its insertion is superior edge of below lying ribs. Now means, see, this is the first rib, okay, and this is the second rib, okay. Inferior edge, of the first rib, okay, and superior edge of the below lying rib. Now here is the external intercostal muscle. And where is the internal intercostal muscle? Superior edge of the rib and inferior edge of the above lying rib. But it is external and internal. Both the terms are similar, but the position is one is external, one is internal. Now external, what it does? It raises the rib. And internal, what it does? It lowers the rib. Now its innervations are intercostal nerves. All the nerves of the deep muscles of back, like deep muscles of thorax, the same innervation is there, intercostal nerves. Now next is the subcostal, next to the angle of the ribs, which is 10 to 12. Inner surface of above lying rib. Subcostal muscles are also inner lining of the thorax, which has the ribs, but which ribs 10 to 12, and its function is like Now next is the transversus thoracic muscle. Now its origin is a xiphoid process and border of the inferior part of the sternum, and its insertion is ribs 2 to 6. And its function action is same as above, like raises the ribs and lowers the rib. Now levator costerium. Its origin is transverse process of C7 and T1 to T11 vertebrae, and its insertion is angle of the closest rib, and its function is raising of the rib. Now these were the muscles which helps in the movement of the thoracic cage and the ribs, sternum, vertebrae. Okay. Now we move on to the joints of the vertebral column and the sternum. See, joints of the head of the rib. Now head of the rib joins with the vertebrae itself. Okay. Now its articular surface is articular facet on the head of the rib and costal facet, which is also called as demi-facet on the thoracic vertebrae. It's a type of a joint which is combination, spherical combination. Axis of rotation is multi-axial and movement is raising and lowering of the ribs. First one is joints of the head of the ribs. What it is? Articular facet of the rib and the costal facet of the thoracic vertebrae. What kind of joint it is? It is a spherical combination joint and axis of rotation is multi-axial. And movement, what it does? It raising and lowering of the ribs. Now next joint is the costo-transverse joint. Now it has articular facet on the tubercle of the rib and costal facet on the transverse processes. Now this joint is also important. See, not only the rib head joins to the costal facet of the thoracic vertebrae, but the tubercle of the rib also get joined with the transverse process of the vertebrae. This is called as costo-transverse joint. In the name itself, the meaning is there. The type of joint is the flat and combination, and axis of rotation is multi-axial, and movement of joint is lifting and lowering of the ribs. Now next is the sternocostal joints. Now the name itself it tells. Sterno means what? Sternum. Okay. And costal joint means what? The costal cartilage of the rib. Now sternal end of the costal cartilage and costal notch means in the sternum. See, this is the body of the sternum. This is the costal notch and here is the costal process of the rib. This joint is called as sternocostal joint. It is flat and its axis of rotation is multi-axial but slightly movable. Now its function is also raising and lowering of the ribs. Now the last one is the interchondral joint. Okay, the interchondral joint, its articular surfaces are cartilages of the ribs 8 to 10 connects with each other, and cartilages of the rib 8 connects to the 7th costal cartilage. See, you have already seen like 7 ribs attached like this, and the 8th one does not articulate with the sternum. It articulates with the costal cartilage of the 7th rib. Okay, so it is written here interchondral joint. This is also a flat joint and axis of rotation is multi-axial and slightly movable. The movement of joint is raising and lowering of the ribs. Movement is very limited. Now, if this question comes, like tell the joints of the vertebrae and sternum and the ribs, there are only 4. It's very easy. You should imagine immediately. Anatomy is nothing, just connection, correlation and imagination. That's it. So first one was the joints of the head of the ribs to the vertebrae. Next is costo-transverse joint. Then sternocostal and interchondral joints. That's it. Now next is the thorax as a whole. See, thorax as a whole, it tells the information about the anatomical position, the structures of the ribs, how it is, the inlet, outlet. See, come. Thorax consists of 12 thoracic vertebrae, 12 pairs of ribs and the sternum. Now this thoracic cavity, it makes a cavity, right? In anterior part, it is the sternum, laterally it is the ribs, latero-posteriorly and posteriorly it joins with the vertebral column, especially thoracic vertebrae. The thoracic cavity serves as a container for the heart, large blood vessels, esophagus and other organs also. Now this thorax is a flat See, now this thorax is a flattened in anterior posterior direction, and it has a shape of incorrect cone. Now it has the four walls, which is anterior, posterior and two laterals. Two aperture, which is superior and inferior. Anterior side is the sternum, posterior side is the ribs, and two lateral sides, anterior side is the sternum, posterior side is the thoracic vertebrae, and two lateral side is the ribs. Now its aperture is superior outlet, inlet and inferior outlet. The anterior wall is formed by the sternum and costal cartilage. The posterior wall is formed by the thoracic vertebrae and posterior section of the ribs. And lateral walls are formed by their side sections. The ribs are separated by intercostal spaces. The superior aperture of the thorax is limited by the T1 vertebrae, the inner edge of the first pair of the rib, and by the superior edge of the manubrium sterni. I have explained completely about this. So this here I have kept very short. It measures about 5 to 6 centimeter from front to back and 10 to 12 centimeter across. Now, inferior aperture of the thorax, it is limited by the border of T12 vertebrae. You should know this topography actually. It is this in this part. It is simple, like a superior aperture. It is limited by T1 vertebrae, and inferior aperture it is limited by T12 vertebrae. But when other organs are coming, other organs, blood vessels are involved into it. It is very interesting also, and to remember it. It is very there are many points to remember. If you would study next two topics also, you would get what I mean to say. The xiphoid process of the sternum is in the front and by the lower ribs on at the sides. Its anterior posterior size in the middle is 13 to 15 centimeter and greatest transversal length is 25 to 28 centimeter. Now the anterior lateral border of the inferior aperture, which is formed by the joints between the ribs 7 to 10, is called as costal arc. Now in Latin term it is called as arcus costalis. The right and left costal arc limit in the infrasternal angle, and the apex of this angle is the xiphoid process. Now, see, the shape of the thorax depends upon many factors, like in particularly constitutional type. Like people of the brachiomorphic constitution have a cone-shaped thorax. Its superior portion is notably narrow than the inferior part, while the infrasternal angle is obtuse. These are the few points which you need to keep in remember. Like if they ask like what are the different shape of the thorax, then you need to tell. Actually it's rare because there are many things to ask into it, but still if they ask, you just need to tell brachiomorphic, its shape is a cone shaped. Now its superior portion is narrow than the inferior and infrasternal angle is obtuse. The ribs are slightly inclined forward. Difference between the transversal and anterior posterior dimension is small, and in people with the dicleomorphic constitution, the thorax has a flattened form. In anterior posterior size is significantly less than the transversal. The ribs are heavily inclined downward and to the front. Okay. Now, whatever I am telling in this, this I have explained in detail in another videos. What is infrasternal, what is costal angle. Okay, so I cannot explain it everything here, so I'm making this video as a short, but you have to watch those videos so you would get a clear cut understanding. Now next is the mesomorphic constitutional type. This here it is a cylindrical shape, and its shape between the intermediate it's intermediate between the conical and flattened. Now, women's thorax is short as compared to the men, and in newborn, the anterior posterior size is greater than the transverse one. But as thorax become longer and more flattened due to the age decrease in muscle tension and lowering of the anterior section of the ribs. Now, the shape of the thorax may be affected by some diseases. Yes, obviously it would get affected, and there is a example like pleuractis. In this, it causes anterior posterior measurement of the thorax to increase, okay, in this disease, and sternum moves towards the forward. It is also called as pigeon breast. Now, movement of the thorax are connected with the acts of the inspiration and expiration. Obviously, lungs are situated in the thoracic cavity. So, as the inspiration expiration it actually acts simultaneously. Like it's not only the one process, like one after the process. No, it is simultaneously. So, during inspiration, the ribs and sternum rises and intercostal space widens and increasing in the volume of the thoracic cavity. During expiration, the ribs and the sternum moves downward, the intercostal space becomes narrow and the dimensions of the thorax decreases. Lowering of the ribs occurs not only due to the work of appropriate muscles but also owing to the weight of the thorax and elasticity of the costal cartilage. Now, till here, I have completed a short part of the ribs and sternum. Now, if this question comes in the viva, so basically you need to start from the development. Then you need to start the ribs and the sternum. Like, what are the parts? In the ribs, there are different types of ribs also, typical or atypical. Like, what is the difference of the first and the second rib? It is the main difference between the first and the second rib is the main part, because vessels are there, many structures are there on the first and the second rib. Then next part would be the joints and the muscles. Okay, then next point, you need to tell about the movement of the thorax. This point is enough for the viva, but you need to be confident while telling. If you feel that I'm not much confident on this topic, you need to build up, then only you would make confidence and you would tell very correct answers on it. So keep studying, keep learning. I would post the next video on the like skull bone and its ontogenesis. Already have done it, but still I would post it here for dissection of anatomy series. Thank you.